what they are looking for is to bring rapid COVID testing to market, which, as I see, is a huge need for the day.
And you are one of the finalists. It started out how big?
So we are in the semi-final at this time.
Well, I want to hear a little bit about how it works, but I think sometimes people might think rapid test, does that mean it's going to be more expensive than a traditional?
Depending on the type of technology that's being used in the rapid test, it may be expensive or not. What we have created in Recover Healthcare is an inexpensive technology. Our device is expected to cost less than $10 per test, which is less than half of the comparables at this time.
Can you tell me about the mechanics? How does this work?
So ours is a very innovative and new technology. We started working on this about a year ago, looking at different saliva diagnostic markers. When COVID came about, we wanted to see if we can apply the same technology for COVID use case. Compared to a lab-based test, there is no special processing needed for the sample. And also using saliva, it's a very convenient way of handling the specimen, not just for the user, but also for the tester.
Right, people now most often have either experienced it or see those big old cotton swabs coming at your nose, and even if you are patient and try not to get too squeamish, it still is kind of poking around and making you uncomfortable. This is not like that.
That is correct. And really the hallmark of our technology is the sensitivity that it has. But as research has progressed, they've seen that saliva also has the presence of viral particles. And that's exactly what we are detecting with our technology.
And it's far easier to get a saliva sample than that nasal swab. Doctor, could you walk me through how this works?
Sure. So our device is a very simple to use device. It's a handheld device. And the way it works is that we have a salivary swab that we provide with the device. You take the swab, put it into your mouth, and within a couple of seconds, it absorbs enough saliva. And within 5 minutes, you'll get a readout of the result.
So in 5 minutes, is this going to be just as effective, ultimately, as the nasal swab?
We know that it already works, and we have excellent results in the lab. And what we want to do is not just bring another test to the market, but one that is highly accurate, that is really quick to use, and that is comparable to the gold standard method that's out there.
So doctor, what inspired you? What was the issue you saw or heard from patients, for the medical community? Was there an issue that you were saying, this isn't working?
What I saw was that the existing point of care technology was really dated. So that was really the need for a better point of care technology.